Hello, my name is Jagroop Kaur and my topic is Recreational Water Safety, which is a public health priority. Here is the outline of my presentation. First of all, I will be providing information about recreational water activities, risk and safety. In the body, there would be more information about exactly what is recreational water safety from the prospect of Red Lotus model. Then, would like to shed some light on the social injustice, and finally, there would be conclusion. Refer to rivers, lakes, and coastal waters, and the activities related to these waters can be defined as the recreational water activities, including swimming, surfing, water skiing, sailing, boating, etc. Recreational water can have various benefits to health and well-being. Swimming pools, beaches, lakes, rivers provide an environment for rest and relaxation, physical activity, exercise, pleasure, and fun. Since the ancient times, bathing in mineral waters has been recommended to cure a variety of illnesses. What is recreational water safety? As water and water-based activities are important aspects of Australian culture, regular exposure to water raises issues of water safety. The risks include accidents such as drowning, exposure to elements, microbial contamination, and chemical pollution. These hazards can be prevented by safety measures. Australian government has made several health policies to regulate the recreational water activities. Drowning is a major threat to people who participate in such water fun activities, as it is fourth major cause of death in Australia. Other than this, drowning is the leading cause of death in Queensland for children under the age of 1 to 4 years. Therefore, it provides enough information that how important it is to have safety regulations when it comes to water activities. Drowning cases have increased with the passage of time. In the year 2015, drowning alone caused 266 deaths, and this number has increased to 291 by the year 2017. While a total of 685 drowning incidents were registered as non-fatal, resulting in hospitalization in year 2016 and 17. Not only this, it has been observed that drowning deaths are more prevalent in summer season as compared to other times of the year. Further, I would be shedding some light on social determinants of health related to recreational water safety through Red Lotus model. First of all, Red Lotus model consists of mainly two types of social determinants, that is individual and environmental. The individual determinants can be further studied as biological, behavior, and socioeconomic, while environmental determinants include social, economic, political, built, and natural environment. To begin with, I would like to highlight individual determinants first, starting with biological factors. It has been reported that males are more prone to experience fatal water accidents as compared to their female counterparts. In this year, a total 249 fatalities have been reported, out of which 72% are males, while females accounted for only 28%. Moving further, next individual determinant is behavior. According to the reports, habits of people can also put them at risk of water-related accidents. For example, addiction to alcohol and drugs has been considered a major risk factor. To exemplify, alcohol consumption contributes at least 20% of all drowning deaths every year. Similarly, drugs are also held responsible for water-related mishappenings, as consumption of drugs can cause impaired cognition, which ultimately put lives of people in danger. In addition to this, according to ABC News, risky behavior of males also put them at front line, maybe because they are more engaged in activities like boating and swimming pursuits. The last individual determinant is socioeconomic status. Studies show that the people who belong to poor socioeconomic groups are also a risk group, as they are unable to organize swimming classes for their children, which ultimately affect their skills in waters. It is estimated that 20% of children will leave primary school without the ability to swim the length of an Olympic sized swimming pool. Ultimately, a potential risk for such children when it comes to water fun activities. It has also been found that these children mainly belong to indigenous communities, rural and remote communities, and people from lower socioeconomic families. Moving to environmental determinants. There are four determinants which can be linked to recreational water safety. First one is social, in which we can study how different social groups are affected differently. To illustrate, migrants and tourists account for every third drowning in Australia, which means they are high risk group when it comes to water safety. The main reason could be that they never got an opportunity to be so close to water in their home countries or restrictions in their social groups they belong to. Furthermore, Aboriginal and Torres Strait Islanders have four times the drowning rate as compared to general Australians, among whom the people living in rural and remote areas are affected more than those living in urban settings. It has been found in reports that the danger is about 1.9 times higher in males of remote and rural Aboriginal communities as compared to urban communities, while in case of females, the gap is much higher, that is 10.5 times. Secondly, environment determinant that can be studied is economical. Aquatic water facilities are the greatest income source for Australian government as it creates a total worth of $2.72 million per year. Not just this, a weekly visit to the pool is enough to make most people out of physically inactive category, which is again a benefit for health field. Moreover, tourism, especially for beaches and lakes, help local businesses. Moving further, build is another environmental factor which plays a critical role. Australia is having a long coastline, making people to indulge more and more in water activities. Majority of Australian population reside near the coastal areas, that is about 85% of total population living within 50 kilometers of the coast, which means water activities are an integral part of their lives and hence increasing the risk of water accidents. Another factor is natural environment. Australia is a land of creeks, rivers, lakes, beaches, hence people can't resist themselves to go in waters. Furthermore, several natural environment phenomena also cause risk. For example, rip currents. Rip currents in Australia are the biggest ocean killer. With 17,000 rip currents happening in Australia at any given time, only 4% of the beaches are patrolled, putting people at risk of water accidents. Lastly, the social injustice. Studies prove that males suffer more water accidents as compared to females, the ratio being 74% and 26% respectively. Aboriginal and Torres Strait Islanders also have four times higher rate in comparison to general Australians to suffer water-related accidents. Immigrants and tourists are also a vulnerable group, while the age is yet another factor. To conclude, to conclude, it can be said that Australia offers various water recreational activities due to its lengthy coastline. Therefore, it is impossible to keep all the area under surveillance and prevent any mishappenings every single time. However, if a salutogenic, holistic, ecological approach is applied to this public health priority, numerous incidents can be curbed. For example, the agenda of government policies should also include educating and making people aware about the potential threats related to Australian waters, rather than just to provide medical help to the fatalities. It should be a multidisciplinary approach, like we have studied various determinants of Red Lotus model, which provides sufficient data that this issue should be addressed from a more salutogenic viewpoint, that is, through awareness, education, behavior changes, legislations, and policies.